I'm Derek, and Derek Book, and I'm the assistant manager of community services at Pacifica Housing. So we have multiple teams. There's about 15 people that I supervise, anywhere from encampment, people that are working in parks, people that are working in the community with folks in subsidized housing, and people in the drop-in center on Cormorant Street. My story goes back to I grew up in a very extremely poor family with a lot of mental health and addiction issues. We traveled around a lot. It was a real mess. I left home at 15, and I struggled with homelessness myself until I was about 20. So about 5 years of getting on and off the street. What really helped me in my recovery was people that believed in me, and not just people that believed in me, but agencies that believed in me. So when I landed in Victoria, for example, at 21, I stayed at StreetLink, emergency shelter. It was very new, it was nice, it was comfortable. Staff were very welcoming. I felt like I mattered. I've been working at this about 25 years now, and just in different resources, in harm reduction, needle exchanges, Indigenous housing support, whatever jobs were helpful. I've really, I've probably housed hundreds of people in my career, and yeah, I just keep doing it. I keep loving the work. It's great. Because of my experience in homelessness, I see the person behind the illness in a lot of cases because I grew up in a family of people that had illness, so I can see that person. And so that is the question that's framed the work I do with people. Who were you before you were homeless? What was the person? I see the housing crisis has developed over years. I've seen it, sort of the lack of social housing being built has left us in a situation where there's not enough resources. And I also see a lot of disconnection between people. I don't see as much personal work. I don't see as much time spent with people in the streets. I don't see as much funding as we used to have. So I think that's really made me realize that it's changed quite a bit. The big key I would want people to understand is that it could be them. I think I've seen so many people in my career from all different walks of life, PhDs, or people that were healthy, people that were, yoga instructors, people that came from bad families, people that came from good families. So I think none of us we're only a few crisis situations away from homelessness, all of us. So when we connect and help people on the street, we really help ourselves. The system has become really complicated, and how people access housing. Of course, there's affordability. There's not enough resources. People don't have enough basic income to rent even the most basic place. I see a lot of people who have complex needs that we don't really have the housing that fits them. And I think that's a mistake. We should have a wider continuum. I think we can help. I believe in the hardest cases. I've often worked with the hardest cases in this field, and I've always found a solution or a place that fits. And supportive housing is really so much cheaper than, say, a prison cell or a hospital bed or the other options, and having people pass away. It's such a better solution. So I think there's a community resilience piece that we can talk about, that if we address housing more effectively, that and then of course there is the mutual sort of win-win in this. I always say, when I'm trying to house somebody, it's a win-win-win, win for the landlord, win for me, and a win for the client. And I think it's also a win for the community. I think the math is on our side because I have worked, I've given my career to doing this work. I've housed hundreds of people. And there's a handful of people that I know that I've helped that are now working in this field, and they're housing hundreds of people. So if we actually do the work and we actually help people where they're at in the right way, we actually create people that want to help as well. Letting people know that we care about them, that they're valued, and that we believe in them is the best thing we can do to lift them out of where they are.